Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Today, we'll be talking about preparing children for surgery with the leader of a national professional organization for pediatric surgical nurses who happens to be a nurse from Upstate. My guest is Mary Ellen Sheridan. She is president of the American Pediatric Surgical Nurses Association, Incorporated. Welcome to the Informed Patient, Ms. Sheridan.
Thank you.
This association develops guidelines and promotes consistency and quality in pediatric surgical nursing. Is the reason so that care will be similar everywhere across the country?
Yes, we think that the consistency is really important for nurses in pediatric surgery to teach many of the same ways and thoughts and processes to help people around the country really increase the level of care through the pediatric surgical nursing teaching.
So you find out what works in one area and you share that to the rest of the country. And as things get better and innovations come along, that's how you're able to share them widely, right?
That's correct. We do have a conference, and I'm sure most nurses in different parts of nursing have conferences they go to and learn things, collaborate with colleagues from different parts of the country, bring those things back to Upstate to help elevate the level of care that we can provide to our pediatric surgical patients.
What are your duties as president?
We have actually a 12-member board, and each board member does something a little bit different. One board member might be developing the program for the conference, and other are doing a lot of developing teaching tools and things like that members of our organization can use in their practice every day. A lot of juggling. I was a treasurer for 4 years and then took a year off. I had an elderly mom, but I just jumped right in and basically trying to give back to people that have given to me when I first started in my role in pediatric surgery.
Now, you've been a nurse at Upstate since 1995. Can you tell us about your career and how you chose nursing to begin with? Was this something you were interested in high school?
I was always interested in math and science, and that kind of, I think, drove me to go down the path of something medical. Certainly, I had some family members who were nurses, and once I started going down that path, I actually volunteered in a hospital when I was younger, and I think that started driving me towards going down the path of nursing.
How did you choose pediatrics as a specialty?
In nursing, you usually do multiple locations, and when I did pediatrics, I really seemed to find a connection, and I enjoyed the family-centered care. It's not only working with the patient, but it's also working with the family and teaching the family and helping them get to where they need to get through in taking care of their child.
Now, in pediatric surgery, being a nurse there, are you in the operating room or what's your job like?
I am not in the operating room. I'm actually in the ambulatory clinic for pediatric surgery. So patients come in, we meet with patients, they have a consultation with our pediatric surgeon regarding multiple different diagnoses. And during that time, if it is determined that the patient needs to have surgery, we do a lot of patient teaching, getting the family ready for the surgical process, talking them a lot about what to expect during the process, things like that, to try and help them become more prepared.
What are the youngest children that might have surgery where you work?
Usually our patient population is birth to 18 years old, although we also do see prenatal patients in our area as well. And then when the prenatal patient has her baby, usually it's our pediatric surgeon on call that's contacted to help provide the care that that patient needs.
What are some of the most common surgeries for infants and toddlers?
For infants and toddlers, we usually see inguinal hernias and umbilical hernias, sometimes undescended testicles or hydroceles, and sometimes even conditions called pyloric stenosis, where there's an enlargement of the stomach muscle.
And then preschoolers or school-age children, as they get older, are there other surgeries that become more common?
They also have inguinal and umbilical hernias, and the school-age children. Usually appendectomies are the most common.
And adolescents and teens?
Some adolescents have chest wall deformities, or they may have some issues with gallbladders or pilonidal disease.
Do you have any tricks for helping to calm children who seem anxious about the surgery that they face? It probably depends on their age, right?
Exactly. A lot of times for infants, they will kind of feed off their parents and any stress that their parents may be feeling. So certainly informing the parents with what the expectations are for the surgical procedure, along with a lot of the surroundings they might see that day in the process of moving from one location to another, things like that. So if we can help educate and help with the anxiety of the parents, that usually will help in terms the anxiety of the infant.
What about teenagers that might be nervous?
For teenagers, we usually try and talk in terms that they can relate to, let them know that there are some choices that they're able to make. Sometimes the doctors may give them choices as far as how they might want to do certain things. Things they will have choices at, but others they will not. But I think the biggest thing is to listen to them, see what questions they have, and address those questions. And then just try and give a detailed but honest explanation about what's going to happen. And a lot of times too, we should certainly use terminology that the patient can relate to. Sometimes we'll use very simple, straightforward language, such as the doctor's going to fix your arm, or sometimes you can use a medical kit or a doll or something and kind of show them the location of where the incision may be. So maybe rather than say a cut, we might say that you might get a small opening.
I see. This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Upstate nurse Mary Ellen Sheridan, who is president of the American Pediatric Surgical Nurses Association, Incorporated. Part of your work at Upstate involves educating and providing guidance to families of pediatric surgical patients. So I'd like to get some advice from you. What information do parents need from the surgeon ahead of time? What should they be asking?
Certainly, they want to know things like where the surgical incision is going to be, how long the procedure is going to take, and also things like what needs to be done as far as after the surgical procedure, the aftercare, what type of pain management they might need. And sometimes they just have general questions regarding activity after the procedure, as far as returning to school, returning to daycare, things like that.
Now, I know it's going to vary based on the type of the operation and the individual patient, but how important is a thorough bath or shower the day before surgery in general?
That actually is pretty important. Certainly, it lowers the risk of post-op infection and reduces bacteria that may be on the skin. So we really do encourage all family members who are having surgery that they have a bath or a shower the night before surgery.
What in general should they bring with them to the hospital if they're going to end up being admitted after the surgery? Do they bring pajamas with them?
They can bring their own pajamas, although most often the hospital has pajamas that they can provide to them. Any comfort items, like a favorite stuffed animal, a book, a blanket, sometimes entertainment items in older children, such as a tablet or a game. Certainly that might help because there is a little bit of downtime between the medical providers that come in and talk to the patient. So during that time, sometimes it's nice to create a little bit of a distraction for the patient.
Good idea. Now let's talk about after surgery. What can parents expect? Like how groggy are kids after anesthesia?
Some kids are a little confused and groggy, want to sleep a lot. Some children can also be agitated. Sometimes it has to do with once the anesthesia wears off and the pain starts developing a little bit more. Sometimes they'll experience some soreness or nausea. So it is important to really keep an eye on them as their anesthesia wears off to make sure they don't fall or make any choices that would be safety concerns.
Let me ask you about pain management because I wonder, particularly with babies that can't talk and tell you how they're feeling, how do you manage their pain level after surgery?
Usually the parents will be pretty in tune with infants, knowing if they're in pain based on how they're acting, if they seem to be a little bit more fussy, things like that. Certainly in older children, toddlers, and preschoolers, they have different ways of showing what kind of pain they might be in by pointing or just being a little sleepy, a little bit more clingy, things like that.
We've always heard that children bounce back faster than adults. Is that true when it comes to surgery? Do you see kids recovering more quickly than an adult might?
Children are very resilient and most often do bounce back quicker than adults. A lot of times you can use alternating doses of pain medication. Also, you can use a lot of non-medical approaches such as comfort measures, distraction, sometimes just being with a child more, positioning them in a certain way that's more comfortable for them than another.
How might activity restrictions differ for children versus adults after surgery?
Usually children want to get back to their normal routine pretty quickly. So sometimes, usually about for the first 2 weeks, they still need to take it easy, especially based on where the surgical incision might be. You want to make sure that they don't do anything to harm or interfere with the healing phase of the incision. You certainly don't want that incision to open up and you don't want it to get infected. That's the goal we're looking for.
Ms. Sheridan, I appreciate you making time for this interview. Thank you.
Thank you very much.
My guest has been Upstate nurse Mary Ellen Sheridan, president of the American Pediatric Surgical Nurses Association, Incorporated. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.